So I'm Das-Munshi. I'm a clinical reader in social and psychiatric epidemiology, and I'm also a clinician. I'm an honorary consultant psychiatrist with South London Maudsley NHS Foundation Trust. So I use the clinical records interactive search, or CRIS, for lots of different types of work. Most of my work is focused on inequalities which people with severe mental health problems might experience. So, for example, we know that people with mental health problems experience an 11 to 17 year gap in life expectancy. So they die 11 to 17 years earlier than the general population. And we've done lots of work using CRIS to really try and not just quantify that, but then also try and understand why that might be the case. And then within that, a lot of work that I've also done using CRIS has looked at ethnic inequalities in course and outcomes of mental health conditions. So we know that, for example, Black Caribbean people are almost 3.5 times more likely to come into mental health services through involuntary care pathways. And so we're currently using CRIS to try and understand the reasons why that might be. So the reason why CRIS is really helpful for this sort of work is because it's all the health records from South London Maudsley NHS Foundation Trust. It covers a very large ethnically diverse catchment area in southeast London, about 1.3 million people in terms of the catchment. One of the challenges is that a lot of the information that we might need to really understand in order to make some sort of assessment about inequalities, so information around people's living conditions, their education, poverty in the household, whether they're a carer, those sorts of pieces of information aren't captured in such a regular way in the health records. So in order to tackle that challenge, we led the linkage of CRIS to UK Census from 2011, and that really helps to fill in the gaps. So we've got a couple of pieces of research looking at essentially the social and economic predictors for the onset, course and outcomes of severe mental health conditions using specifically that data linkage. We have a study which looked at whether city living is associated with a higher risk of developing psychosis and other severe mental health conditions, and we have found that to be the case. It's a small sort of effect, but we're looking in a very urban catchment area. And then within that, we found something that's very striking, and it's come across all our studies, is people who are living in single-person households. So you might sort of impute from that they're socially isolated, are much more likely to develop a severe mental health condition, and they're also more likely to have poorer outcomes if they develop a severe mental health condition. And that might even include outcomes like mortality, so dying earlier, or employment outcomes and so on. So it seems that social isolation possibly plays a big role in terms of the experiences of people living with severe mental health conditions. And that's I think it's a very new finding. I mean, it's been shown in other studies, but not at the scale that we've been able to do with the CRIS records. And so it really lends itself to thinking about interventions and ways that we might be able to help people to, sort of try and modify that risk of those sorts of outcomes.